You know what else is hot aside from the Arizona summers? Competition among disposable and single-use cystoscopes. In this video, I'm going to go over my first impressions and review of the UroViu G cystoscope cannula. Right now, you've got UACRS, NeoFlex, G-scope, A-scope, and also Prime Sight with their sheath system competing among probably others that I didn't even mention regarding these single-use disposable scopes. There have been recent issues with recalls by Storz, sterilization issues, infection issues, and also the ease and portability of these scopes that have come into play. So a lot of people are looking at disposable scopes for numerous reasons. I recently had the opportunity to try UroViu, which is Uro G, using their cystoscope cannula, and I'm comparing this with the Olympus CYF V2R, which is a digital reusable scope that I've been using for a long time. As usual, if you have any comments or questions or suggestions, leave them. I will try to answer them here live or on the replay. If you want to look or watch the unboxing of the UroViu handle and the Uro G cystoscope cannula, click on this link over here. Let's get right into it. So this is the handle portion of the UroViu. Let me switch cameras here so I can show you. So this is the handle portion. There we go. And you have an articulating screen that you can turn. And I'm right-handed, so I'm going to be holding it like this, so I can watch the screen here. To turn it on, you press this button temporarily, and there you go. To attach the cannula, now they make different cannulas. These are called, the disposable portions are called cannulas. This is the Uro-G cannula. You've got the electronic connection here. This is the lever to control the deflection of the tip. You have a rotating sheath, and this can go here or over there. As it comes from the factory, it'll be on the right side here. But the way we have it set up in our office, we like to move this over here so that the fluid can come in from this side, and I can manipulate this here without the fluid tubing getting in the way. You connect the electronic connection here by pushing it up. It's pretty straightforward. And then this portion here, you simply line it up and push it up just like that. And then you have it connected. To turn on the video portion, you just click on the tap on the camera icon here, and you are looking at a view, an image using the UroViu Uro G cannula. So pretty straightforward. You can bend up, you can bend down. And if you want to capture an image, let me rotate this. Oh yeah, the screen rotates and articulates this way as well. To capture an image, you temporarily press this button here, and it captures the image. And if you want to capture video, press this button and hold it. And you see that blinking red light. Now it's capturing video. To stop, tap it, and it stops. Pretty straightforward. And if you're done, you can turn it off here by pressing and holding the button here, and then pressing these two levers here and removing the electronic connection and pull it out just like that. Okay? Pretty straightforward. And this screen articulates this way articulates this way and articulates all the way down that way. And also to the right as well, or on top of your screen. I'm right-handed, so for a male whose head is over to your left side of the screen, I'm holding it with my right hand. I'm looking at the screen, and then I'm manipulating the telescope this way and adjusting the lever this way. All right. Some of the complaints that I have regarding the scope, I think is a good idea, but I don't think it's 100% ready for prime time, and that's going to be my bottom line. This here, the shaft is pretty stiff compared to my CYF V2R, my Olympus reusable scope. This is pretty stiff. Also, there's no narrowband imaging. This is all you get. There's no narrowband imaging light source compared to my Olympus CYF V2R. Of course, this is much more portable, so it's a different use case, but that's just something that I missed when I was performing cystoscopies, looking for bladder tumors, looking for recurrence of bladder cancer. In addition, this port seal right here is pretty darn tight. So you take this cover off. If you're going to use it, you have to take that cover off. And then this blue thing here is very tight. You may have to use KY before you insert anything through the working channel. And once you put something in a working channel, this thing actually will telescope in and out because it is that tight. And if you're not careful, you may damage graspers that you may be using, inserting through this channel. This is not, the aperture is not adjustable. So that is a downside that I noticed. I used about 10 of these devices in a demo, and I'd like to give a shout out to Sebastian Cadet for coming over here and giving us a demo and letting me trial about 10 of these disposable cannulas. Okay, my complaint number 4, and this is a pretty big one, is that the turning radius, this thing here, how much room it takes before it makes the turn, this is simply too large to go up and down deflection. When I would use this to look into a bladder and I couldn't see the ureter orifices after getting into the bladder neck, and then I want to go posteriorly to look for the ureter orifices, I couldn't reach it with this. And immediately after attempting it, I removed this disposable system and I used the CYF V2R, my Olympus system, and I was able to get right down posteriorly to see the ureter orifices. Let me show you a comparison between the CYF V2R, the Olympus scope, which is on the left side of your screen, with the UroViu G on the right side. The turning radius is tighter with the CYF V2R, the Olympus scope. Here's another view. You can see with the UroViu G on top and the Olympus reusable scope on the bottom, you see how the radius is much bigger. The turning radius, when you retroflex it, is so much bigger than the Olympus scope. Here's another view for perspective. So the diameter, the turning radius is bigger using the Uro G. And that can be an issue if you can't distend the bladder and you have to retroflex the scope. That may be a little bit more difficult. And if you are looking the other direction, you can really see the difference. See how quickly the Olympus scope on the bottom can make that turn, while the Uro G takes a much more gradual turn, and that is going to be a problem if you have a slightly enlarged prostate, intravesical prostate that you're trying to get over, and you want to look at the ureter orifices. You want to be able to get in and turn right away and be able to try to see the UOs. It's going to be a little bit more challenging with the UroViu G, the Uro G by UroViu. So that was one problem that I ran into when I couldn't see the UOs by attempting to flex posteriorly using the UroViu Euro G cannula. So that's an issue. Okay, let's get down a little bit more regarding this handle here. All right, this deflection handle here, it's a little tight to move it forward and back, and I don't think it's very ergonomic. For instance, for retroflexion, I would pull this towards me, and then this is now retroflex. So towards me is retroflex. Now, if you are using this with two fingers here, one to push forward and one to pull back, the middle finger to pull back and the fourth finger to push forward, if you want to fully retroflex the scope, you are now pinching your fourth finger against the handle right here. And this is the amount of deflection. Now, if I were to remove my finger and then pull it a little bit more, you get a little bit more deflection. So this is with the finger in place, and this is with the finger moved away. So if you have pretty skinny fingers, but if you have fatter fingers, you won't be able to deflect as much. Also, pushing it away, I wear 7.5 gloves. So I have relatively average size hands. To push it forward and to flex posteriorly, this is awkward. I can't, it's really awkward for me to spread my fingers with one hand to extend my fingers here so that I could fully deflect posteriorly. Now, granted, you're probably not going to be doing this much, but I'm saying pushing this way is a little awkward because of this distance right here. So that's something that I found. Now, using a standard reusable scope to turn left or right, you simply move your hand like this. You do not do that with this scope. You would turn using combination of rotating the sheath and moving the handle to get to where you are. You no longer do this maneuver when you're using this. So that's something a little different when you're using this disposable system. So the ergonomics, not a big fan. All right. I also have noticed two or three instances where I had the scope right at the bladder neck and it's gotten stuck there at least 2 to 3 times. I then take this scope out, use the Olympus scope immediately, and I was able to get right into the bladder. So I'm not sure what was getting stuck near the bladder neck using this scope. It's pretty smooth. I don't know if there's some sort of collaring that's going on, bunching the rubber right here. I'm not sure what it is, but I had some difficulties trying to drive the telescope into the bladder. So let me show you a video of a video image captured using the UroViu G. This is a male patient, bulbar urethra, getting into the prostatic urethra. You got enlarged lateral lobes. You just saw the verumontanum posteriorly just now. So the image quality is not bad. It's the typical 400 by 400 pixel. I think there's a much better sensor coming out. So this guy's prostate's enlarged. He's got a posterior lobe that extends up to the left side of the prostate, trabeculated bladder. So in order to turn, I'm using the handle and then to rotate, to look left or right, I would not move my hand. I would rotate the sheath of the Euro G cannula. More trabeculations, and I'm going to retroflex the scope right now. Like now, anytime. There we go. You can see the prostate is slightly pushing into the bladder, and there's the bladder neck with the scope retroflex. The bladder is nicely distended. I'm rotating the sheath of the cannula to perform that maneuver, and that is a typical cystoscopy using the UroViu Euro G cannula. So one of the things that you can't do is that this is only one screen. So you can turn it this way or turn it this way. I'm using it right-handed, so I'm going to be looking at it. If I want to show it to the patient, I would lose visualization and maybe turning it this way and tilt it down so that the patient may be able to see it. Otherwise, you can capture images and video, save it in this device, this handle, and then show the patient afterwards. What I like to do is be able to narrate what I'm seeing with the patient. So if I have two screens, for instance, right now with the Olympus scope, I have a screen right in front of me and a screen at the foot of the bed. The patient's head is over here. He can look over that way and be able to see the screen, or he can try to see the screen that is in front of me. I can narrate the landscape of the prostate, show him the trabeculations, the obstructing lateral lobes, and show him the posterior, the median lobe that is coming up, and also the intravesical intrusion of the prostate, and maybe any stones in the bladder, or maybe tumors in the bladder. You can't do that in real time using the single screen that is attached. Another little bit of a something that's a little bit annoying is that you can save images and perform this procedure and save images, videos and images by putting in case ID numbers. You don't necessarily have to put in a case ID, but if you want to put in a case ID, so for instance, patient number, you can only enter 4 digits. That's the max. You can't put in more than 4 digits. That may or may not be an issue. So that may or may not be an issue. You can charge this handle 4 hours. That'll give you about 2 hours of runtime. Something annoying to me is that once I plug this handle into the cradle, it resets the date and the time. It resets the date and the time. So I'm not sure if that is by design or what, but this is software version 2.0.006. So that is something a little bit annoying. Whenever I plug in the cradle to charge the handle, it would lose the date and the time. It resets. Okay, let's talk about the pros of this device. You can deploy and perform cystoscopies pretty much at any time. You can not only can you do it at any time, you can do it pretty much in any exam room. You don't need a dedicated procedure room. For instance, my Olympus CYF V2R requires a tower, a big old box with light source, with digital processor. So you can't just wheel that thing around very easily. Whereas with the UroViu G, you can literally take it anywhere. Heck, you could probably do it in the parking lot. You can do it in the back of your car, back of your van. You can pretty much perform this in any area because it is portable. The cannula is disposable. You can set it up and you perform cystoscopies at any time. The deflection movement is similar to the CYF V2R, the Olympus. Now, the retail price is about $155 for each one of these cannulas. Of course, if you buy more, I'm sure you can save money with volume. And I'm actually going to be trialing a different disposable or single-use cystoscope coming up in the near future. I would love to hear about your experience if you've tried this or other brands of disposable single-use cystoscopes. For now, because of the deflection issue posteriorly and this thing getting stuck at the bladder neck a couple of times, I can't give my endorsement to this particular device, although conceptually, this is really cool. It's a tiny, very portable setup. If you have outlying clinics that you don't want to drag the entire tower and you want to be able to perform cystoscopies, this is a really, really good way to go. I like the articulating head or the screen, and I like the fact that this is very, very light. There is an 18650 lithium ion battery inside this handle with 3100 milliamp hour capacity. Again, 4-hour charge will give you about a 2-hour runtime. It's really cool. It seems really well built. And once they perfect the handle, which from my understanding is that they are going to continue to perfect this handle, And so look forward to improvements in the future. But as of now, because of this deflection, inability to deflect posteriorly, and the turning radius being too big with that deflection, I'm not going to be able to endorse this scope at this time. So just so that you are aware, you always follow the money, right? No, I am not being paid to make this video. I was simply given a few of these to trial on patients, and that's it. This is my honest opinion. I know you like my reviews because I'm not biased by any company. I'm not being paid by any company to provide these reviews, and I thank UroViu for giving me the opportunity to trial numerous Uro G cannulas with their UroViu handle, and I'm sure they will improve on this deflection issue. But neat idea. Let me know what you tried or what you have seen when it comes to disposable scopes. Look forward to hearing from you. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.